Hello everyone, welcome to my channel. This is Dr. Meenakshi Gupta. Today I am going to start another topic of pharmacology, that is antiviral drug. So what are the viruses? Viruses, they are obligate parasite. They are obligate parasite, which means they are going to take the obligation, or they have to take the obligation for its multiplication. Now they are going to take the obligation of what? They are going to take the obligation of the host cell to which it is going to infect. Suppose if it is a mammalian cell, so once they enter the cell, and how they are going to enter within the mammalian cell? Through either by respiratory tract, like if we see the chickenpox virus, influenza virus, rhinovirus, they are going to enter through the respiratory tract, or through the GIT, like enterovirus, hepatitis virus, various virus causing the gastroenteritis, then even through the skin, papillomavirus, molluscum contagiosum, then through the conjunctiva, adenovirus, and then even the vertical transmission, rubella, cytomegalovirus. So once they enter within the cell, then what they are going to do? They are going to use the metabolic machinery of the host cell. They are going to give the direction to the metabolic machinery of the host cell. Now host cell, it is going to prepare all the material which is required for the viral replication. So this is very important. So because of that, the viral chemotherapy, it is difficult. Why it is difficult? Because if we are going to give any antiviral drug, the chances are it may interfere with the cellular metabolism of the host cell, because the virus, it is now within the host cell. It is a obligate parasite. So that is going to make the viral chemotherapy difficult. So viral chemotherapy, it is difficult because chances are it may interfere with the cellular metabolism of host cell. So interference in the cellular metabolism of cellular metabolism of host cell. This is number one. Number two, by the time the patient comes with the symptoms, then what will happen? The viral replication, that is at its peak. Viral replication is at the peak by the time patient comes with the symptom. So that means you have to give the antiviral drug either prophylactically or during the incubation period. But we have few viral specific enzyme. Okay? Viral specific enzyme, they are there, like in case of influenza virus, we have enzyme neuraminidase. We can hit this. Then in case of HIV virus, we can target the enzyme reverse transcriptase, protease. So that means to make it effective, antiviral drug, we have to find the target which is going to hit the virus without affecting the host cell. Now the next is how this virus, it multiplies. So let's see how it multiply, and then we'll be seeing what are the important target or what are the important checkpoint where we can hit this virus. So viral replication. So this is a virus. It consists of a genetic material. It can be RNA or DNA. If it is a RNA virus में RNA होगा, ठीक है? Just like influenza virus, HIV virus, a single strand of the genetic material. If it is a DNA, like hepatitis B virus or herpes virus, so single stranded genetic material which may or may not be covered by the capsid or protein code. So this together, it is called a nucleocapsid. And this virus, it may have envelope or may not be having the envelope. If there is an envelope, then we will say it is an enveloped virus. If there is no envelope, then it is a non-enveloped virus. So we classify viruses depending upon its genetic material and we classify it depending upon whether it's enveloped virus or it is a non-enveloped virus. So this is a host cell. This is a host cell where the virus is going to multiply. Now the first step is the fusion of this virus with this. So that is the first. The second step is its penetration of this virus. So this nucleocapsid. So once the virus it enter, then what will happen? This envelope part, it will not enter. It is only the nucleocapsid part that is going to enter within the cell. So the next step is uncoating. Next is uncoating. Now what happens in uncoating? This capsid part, ये वाला जो आपका part है red, this capsid, this will be removed. So what will happen? Only the genetic material will be there. And the next point is early protein synthesis. Early protein synthesis. And then there will be nucleic acid synthesis where genetic material will be synthesized. Then late protein synthesis. And then there will be packaging and processing. The packaging of all the material. ठीक है, ये आपका early protein synthesis. यहाँ पे आपका आ जाएगा maybe there is a synthesis of DNA polymerase. If it is a DNA virus or RNA polymerase, then there is a nucleic acid synthesis, various genetic material that is synthesized, and then late protein synthesis, rest of the protein they are synthesized which is required for the virus, and then packaging of the viral particle. That means the genetic material and the capsid, the whole thing will be packed together, and then there will be this release. So these are the various steps of the viral replication, or they act as a checkpoint where the antiviral drug can hit and inhibit the viral replication by acting at different sites. Let's see what are the various drugs. Here the important is this fusion of the virus with the host cell, that is inhibited by giving the fusion inhibitor, and the important drug are enfuvirtide, maraviroc. Then the penetration of the virus, that is inhibited by the hepatitis B virus, hepatitis C virus. Then uncoating, this is number 1. Number 2 is penetration, this is inhibited by this. Then uncoating, this is by the amantadine and rimantadine. Then this early protein synthesis, this is inhibited by formivircin. Then a nucleic acid synthesis inhibitor, many drugs they act at this site. So this is number 4. Number 5 is like nucleoside reverse transcriptase inhibitor, like zidovudine is there, stavudine is there, diadenosine is there, a long list is there. Non-nucleoside reverse transcriptase inhibitor. So these drugs are used against the virus HIV. So we'll be discussing in detail when we'll be taking the anti-HIV drug. Then acyclovir. Then late protein synthesis, this is by the protease inhibitor. This is another group of drug which we use as an anti-HIV. Then next step is the release of the virus. This is by the neuraminidase inhibitor. They are going to inhibit the release of the virus. So this is how the different antiviral drug, they are going to act at different steps of the viral replication, and they are going to act as an antiviral drug. So we have the antiviral drug presently against herpes virus, influenza virus, hepatitis virus, HIV virus, and very important, coronavirus. So in today's video, I will be taking the drugs which are used against the herpes virus. So anti-herpes drugs I will be taking. So anti-herpes drug, what are the drugs which are used against this? They are acyclovir. I'll be taking this one first. This acyclovir. This is an anti-herpes virus drug. So you can see here only how this drug it is going to act. Acyclovir. It is going to inhibit the nucleic acid synthesis. Okay? It is going to inhibit the nucleic acid synthesis. And for the synthesis of nucleic acid, what we require for the nucleic acid synthesis, just I am telling you a basic thing. So we require either purine and a pyrimidine. ठीक है, आपको न्यूक्लिक एसिड सिंथेसिस के लिए देयर इज अ न्यूक्लिक एसिड किसे देयर इज अ nitrogen base, along with that there is deoxy sugar and phosphate. So for the nucleic acid synthesis we require either purine or pyrimidine, or you can say adenine, guanine, cytosine and thymidine. ठीक है, so we require purine or pyrimidine. Purine pyrimidine कैसे? We need adenine, guanine, cytosine and thymidine. ये हमें ये चाहिए. ठीक है. So if we are going to give a drug, suppose acyclovir, ठीक है, if we are going to give a such kind of drug which mimic with this, जो इसके साथ with the structural resemblance with this, then what will happen? The virus, instead of taking this adenine, guanine, cytosine, it is going to incorporate acyclovir. So here the drug which usually act by inhibiting the nucleic acid synthesis, they are either side or tied. They are either side or tied. Like acyclovir, it is a guanosine analog. So they are either purine analog or they are either pyrimidine analog. Like acyclovir, it is a guanosine analog. So this is structural resemblance with the guanosine. So what will happen when the nucleic acid synthesis it is going on within the virus, then what will happen? Perchance, instead of picking up this guanosine, this virus, they are going to take up the acyclovir. Then further the synthesis of DNA will not happen. Okay? So herpes virus, how the acyclovir it is going to act. So you can see here the structural resemblance. I'll show a little bit. So this is a acyclovir and this is a guanosine. This is a structural resemblance, except यहाँ पे आपको जो 3 hydroxy ये नहीं दिख रहा, this is not there. So acyclovir it is inactive as such, so it needs activation. Its structural resemblance is with the guanosine, so it is a guanosine derivative. Now the first step is activation of this acyclovir. So acyclovir guanosine activation इसकी कैसे होगी? By the incorporation of the phosphate. So first step is activation. So the phosphate, here you can see acyclovir, it is inactive. So phosphate initial is monophosphate. So for the incorporation of the monophosphate, what we need? We need a kinase enzyme. Now which kinase it is participating here? कौन सा kinase कर रहा है? Here you can see the cross. It is a virus specific thymidine kinase. So initial the monophosphate with the acyclovir, that is with the herpes simplex virus specific thymidine kinase. So monophosphate and then diphosphate and then triphosphate. So the another phosphate is with the activation of the host thymidine kinase, and the third phosphate that also requires a host thymidine kinase. Now what is the significance of this? Now the activation of the acyclovir, it requires what? It requires the kinase. और कौन सा इसको kinase चाहिए? It requires a virus specific kinase. So that means acyclovir, this drug, it gets activated where? It gets activated within the host cell which are infected with virus. Okay, acyclovir, it gets activated where? It gets activated within the host cell which are infected with the herpes virus, because it needs the activation. So for the activation, what it needs? It needs a herpes simplex specific thymidine kinase, which it is going to get where? It is going to get in the host cell which are infected with the virus. So what is the significance of this? That means this acyclovir is not very much toxic to the host cell, because it is mainly, it enter which host cell? Which are infected with the virus. So it is not effective to the host cell where, which is not infected with the virus. So initial activation requires herpes simplex specific or viral specific thymidine kinase, monophosphate, and then number two, another two phosphate, they require the host specific kinase. Now once it gets activated with the acyclovir, ये आपका triphosphate जब बन गया this, then what will happen? Now it is, it's structural. Now it gets activated, 3 phosphate इसके साथ लगे. Now it is going to compete with what? It is going to compete with the DNA polymerase. Now see the second step. So incorporation of this DNA polymerase, and here DNA polymerase. So this is the normal when there is a synthesis of the DNA, there is incorporation of the guanine with this. Now the acyclovir triphosphate, after it gets activated, then what will happen? The structural resemblance between this and this, instead of taking this, what will happen? The cell, they are going to take up this acyclovir triphosphate. Number one, this. Number two is there is a competition of this. Isme or isme. They are going to compete for this enzyme, DNA polymerase. So once if this gets incorporated, अगर acyclovir, if this comes and attach with this, then what will happen? एक बार अगर acyclovir लग जाता, then further synthesis of DNA, that is inhibited. Number one is this. Number two is it is going to inhibit this DNA polymerase irreversibly. So these are the two ways how this acyclovir it is going to act. So in a simple way, you can write here the acyclovir it is inactive as such. So it gets activated into acyclovir monophosphate with the viral specific thymidine kinase. Here the enzyme needed is viral specific kinase is required. Then acyclovir triphosphate. Now this triphosphate, it require what? It require the host kinases. The next step is it gets incorporated in the DNA, gets incorporated within the DNA and stops further lengthening of the DNA and stops further lengthening of the DNA. And here it is going to inhibit DNA polymerase irreversibly. This is how this acyclover it is going to act. Okay. Now acyclover, they are used against, they are the anti-herpes drug. Now the herpes virus, it includes what? The herpes virus, it includes herpes virus, whatever against which we are using the drug, herpes simplex virus 1, herpes simplex virus 2, then we have varicella zoster, Epstein-Barr virus and cytomegalovirus. These are the 4 against which we need a drug. Now herpes simplex virus 1, it causes what? It causes mucocutaneous herpes simplex. Mucocutaneous herpes simplex. Herpes encephalitis. Herpes keratitis. Whereas this one, this causes the genital herpes. And then this causes chickenpox and varicella zoster, and this causes the cytomegaloviral infection. Now acyclover, it is used against the herpes virus. It is effective against which virus? It is effective against herpes simplex 1, 2, even this also, but not effective against this. Now what are the limitation of this acyclovir? So limitation of the acyclovir is, number 1 is bioavailability, that is very less. It is only 20%. And then another one is half-life, that is 3 to 4 hours. This is another. And then next one is, it is not effective against cytomegalovirus. Fourth thing is resistance is developed. These are the limitations of this, of acyclover. So acyclover, its bioavailability is less, half-life is less, then it is not effective against cytomegalovirus. Then resistance. Resistance developed due to what? Resistance developed due to, because it needs viral specific thymidine kinase. So there is a mutation in that virus specific thymidine kinase. Because of the mutation of viral kinase, what solution we have? Acyclover, we have drugs like valacyclovir. So their bioavailability is better, half-life is better, and they are more effective against the varicella zoster. Because acyclover, though it is effective against the varicella zoster, but the post-herpetic neuralgia, that is not prevented. So valacyclovir, that is the drug of choice for herpes zoster. Because of the better bioavailability, it is a valyl ester of acyclovir. As soon as you give the val acyclovir, it is converted into the acyclovir. So bioavailability, it is 70%. Half-life within the infected cell, it is more. So it is a drug of choice for the herpes zoster. Then another drug is, we have famciclovir. Now the famciclovir, this is also with a good availability is better, and this is also effective against the herpes zoster. Okay, and then it is also effective against the hepatitis B virus. Now we have a drug for the mucocutaneous herpes simplex, herpes encephalitis acyclovir. So these two drugs, val acyclovir and fam acyclovir, they are alternative to acyclovir for all these indications: mucocutaneous herpes simplex, herpes encephalitis, herpes keratitis, genital herpes, chickenpox, and varicella zoster. So these are the uses of acyclovir, val acyclovir, and fam acyclovir. So always remember, whenever you are writing like mucocutaneous herpes simplex, if it is a mild, you just give a topical cream. Topical cream lagao. If it is a little bit severe, you can give a oral. If it is an immunocompromised or with a frequent recurring lesion is there, then you have to give the IV. Same with the herpes encephalitis, इसमें भी you give a IV. Herpes keratitis, you give the topical preparation. Genital herpes, if it is a local, ठीक है, mild है, तो you just give a topical preparation. So if there it is a little bit severe, then you give a oral preparation too. And if it is happening recurrently and in a immunocompromised, then topical preparation it is not going to work. Even oral preparation, that is also not going to work. तो यहाँ पे आप क्या दोगे? You have to give the IV. Same for the chicken pox, you give the oral, and herpes zoster here also, or varicella zoster, you have to give either oral or IV. Now what is left? What to give for the cytomegalovirus? अब cytomegalovirus के लिए हम क्या देंगे पेशेंट को? So for the cytomegalovirus, so all these drugs, acyclovir, val acyclovir, then famciclovir, they are not at all effective against cytomegalovirus. So for the cytomegalovirus, we have a ganciclovir. So remember, all these, they are the guanosine analog. Whether it is a acyclovir होगी आपकी, val acyclovir, famciclovir, यहाँ पे मैं ganciclovir, they are guanosine analog. And how they are going to act, their mechanism of action is same, just like the acyclovir. So first step is their activation. So activation needs what? First is viral kinases. With the viral kinases, it will be converted into monophosphate, like here ganciclovir monophosphate, and then the host kinases, they are going to convert ganciclovir monophosphate into ganciclovir triphosphate. So this ganciclovir, it is will be effective against all the herpes. It is herpes simplex 1, 2, varicella zoster, and even cytomegalovirus. But it is too toxic to be used for these indications. So we are using it for the cytomegalovirus. And what is the most important toxicity of this? It is a bone marrow suppression. And here this ganciclovir, this is also the oral bioavailability, it is very less. So we give in a injectable forms. So another analog of this one is a valganciclovir, which can be given orally. So it is concentrated in the this ganciclovir and valganciclovir, it gets concentrated into the cytomegalovirus infected cell. उसमें cytomegalovirus infected cell, इसमें क्या होगा? It gets concentrated in that. And where we are going to use this cytomegaloviral infection, it is very common in a immunocompromised patient, and it causes what? It causes, the most important is cytomegaloretinitis, then colitis, then pneumonia. So this true drugs, they are used in all these indications. The thing is, this is given by parenteral route and this is oral bioavailability, that is good with this. And if the cytomegalovirus, if they show the resistance with the GAN cyclover or val GAN cyclover, then what is the other alternative we have? Then we can give the cidofovir. We can give the cidofovir. What is important about the cidofovir? It is a cytidine analog. It is available as a monophosphate. So it does not require viral specific kinase for its activation. It only requires a host specific kinases because it is already one phosphate that is attached. So to convert cidofovir monophosphate to triphosphate, it just requires the viral kinase. So it is too toxic. So viral specificity of this drug, it is very less. On the other hand, it is effective against all the viruses, all the herpes viruses, whether it is a acyclovar resistant herpes virus, GAN cyclovar, val GAN cyclovar resistant cytomegalovirus. It is also effective against the adenovirus. So this is the advantage of the cidofovir. And another drug which we can use if the cytomegalovirus they show the resistance, then that is a phoscarnet. So what is the important about the phoscarnet? It is not any nucleic acid precursor. It is going to directly inhibit the DNA polymerase, viral DNA polymerase enzyme, and along with that it is also going to inhibit, ये क्या करेगी, viral DNA polymerase, it is going to inhibit that, and also HIV reverse transcriptase enzyme. It is going to inhibit both these directly. So where we can, it is also effective against cytomegalovirus, which is showing resistance to GAN cyclover or val GAN cyclover, also effective against the herpes virus, which is showing to the, or herpes simplex 1, 2 and varicella zoster, which is going to show the resistance with the acyclover. So there we can use. And if any patient with the cytomegalovirus, HIV patient infected with the cytomegalovirus, if we are going to put the patient on phoscarnet, it is going to reduce even HIV titer. So this is used for the cytomegalovirus, जिसमें retinitis है, colitis है, pneumonia है. So it is going to show the effect. So what are the anti-herpes virus drug? Today I have discussed. One is acyclovar, then val acyclovar. Acyclovar, it is a very good drug. It is used against all the herpes simplex viruses except the cytomegalovirus. But bioavailability of this drug, it is less. Number 1 is this. Number 2 is half-life. Number 3 is resistance. And number 4 is it is not effective against the cytomegalovirus. So what alternative we have? We have val acyclovar, we have a fam cyclovar, which are effective against the varicella zoster, especially the val acyclovar with a good oral bioavailability. Drug of choice for the varicella zoster is val acyclovar. And fam cyclovar, that is effective against the varicella zoster. Along with that, it is also showing the activity against the hepatitis B virus. Then for the cytomegalovirus, we have the various drug GAN cyclovar, val GAN cyclovar. Number 1 is this. Number 2 is val GAN cyclovar, cidofovir and phoscarnet. If the cytomegalovirus, they show the resistance to GAN cyclovar and val GAN cyclovar. So that's all about the antiviral drug which are used against the herpes virus. So far, what I have covered, what kind of question you will be getting in the examination, the classification of the antiviral drug, write the mechanism of action of acyclovar, its therapeutic uses and adverse effect. So this is very important theory question. So in today's video, I have covered the drug which are used against the herpes virus. So if you have any query regarding this, regarding today's video, so you can ask in the you can ask your query in the comment section. And thank you for watching my channel.